watching One More Step Virtual Health Weekend. This program is held in conjunction with TechDome's Penang 2021 Virtual Glo-Walk. Our expert today is Dr. Saraswathi Bina Rai, a public health medicine specialist and also an associate professor from Faculty of Medicine's AIMS University. Last year, Dr. Saraswathi was nominated for Metrodora Award for Women in Science 2020, and in 2019, she was awarded the Malaysian Medical Association Outstanding Public Healthcare Services Award 2019. Dr. Saraswathi will share with us about COVID-19 and children heading back to school. Let's welcome Dr. Saraswathi Bina Rai.
Hello, good afternoon, everybody. So first of all, I would like to thank TechDome Penang for inviting me to talk about COVID-19 and children heading back to school. So what I'm going to cover today is my scope will be basically on the protection for children. I'm going to talk about the situation, a little bit about the teaching systems, school systems, and then I will go on to what you should do as a student, a little bit about vaccinations, and then we'll end it all up with summary. So just a little bit about data and the number of COVID cases in Malaysia. So as you all can see, we have up to today, or rather on the 9th of August 2021, we have about 1.2 million cases of COVID-19. And with the highest number being in Selangor, and where we are in Penang, there's about 53,276 cases. So there really is a lot of COVID going around. The information about COVID is aplenty. You can open up daily newspapers, you can look into the news, and every day it's all about COVID. So this data is very dynamic and it will keep changing, as you all know. And even the information that we have about COVID keeps changing all the time. So at the moment, since the 1st of June 2021, children have been told not to go out anywhere. You've been asked to stay at home and in fact, not even go to the supermarkets and so forth. So there is going to be a time when you're going to go back to school because this lockdown is not going to happen forever. So how are we going to do it when you start going back to school? There are still many ways that school can go on. It can go on totally online, as it is going on now. So in which case, there is really no change. Just please stay at home and stay safe. What we are hoping is that things really die down and you are able to go to school. So then you have a physical system. But even being physical, you have to ensure that you remain safe in school. The other option is a hybrid system where you have a mix of both online and physical. So this may be the way to go for the next few months, but we have to see how the disease is progressing, how things are developing. So what I'm going to talk about is, what are the things that you need to allow you to go back to school? How should you carry yourself? What is it that needs to be done? So let us look first of all at the structure of the school. This has already been there when you went to school earlier, in that few weeks that you were allowed to actually go back to school. I know students have really missed out the interaction with other students, but this is all over the world. So what we want and we hope to maintain is that your desk are all spaced out as it is in this picture, and they are all to face the same direction, because we don't want this one, because we don't want it this way where the desks are facing against the wall and there's so much of head movement and children are facing in all directions. So this is not a good way for it to be. And if possible, we like decreased number of students in a class. In a small space like in this classroom, you cannot cramp these children together anymore. Not at this point in time. Maybe it will come in a few months maybe in a year, but right now, this is not the way to go. What would be ideal is if we have the funds and the resources to have partitions. That means you break down the separate, or you separate the spaces between the children. So you can have like a plexiglass, or you can have like shields to cover them, so that if they talk and they speak, the aerosol doesn't pass from one student to the other. So in a way, you're actually protected if you've got the partitions and you've got the plexiglass. Now, of course, when you go to school, you need the school bus, right? It would be good if the parents can drop the children off to school. But in case you cannot and you are dependent on the school bus, what we would like is to decrease the number of students in a school bus. The olden days, when it is packed to capacity, maximum, every seat has been taken up. This will not do for the current purposes. Not now, maybe later. So even the bus cola, it has to be spaced out, and the number of students who are sitting, it will be more appropriate if all the seats in one side of the bus, that if there are double seats, only one seat is taken up, so that there is space between the students. So at the time, so the pickup and drop off definitely has got to be scheduled and scattered, so that not everybody comes to the school at the same time. Not everyone leaves the school at the same time. Because what we really want to do is try and control the number of students who are clustering together at any one point. So the pickup and drop off will be ideal if it could be separated and if it could be staggered. Social distancing. This is not going to stop for a long time. So social distancing is basically physical distancing. For anyone outside your household, you try and maintain that 6 feet distance from them. And if possible, even when you're in school, to be more exposed to outdoor spaces where possible, where there is good movement of the air, where the airflow is very good, and there's no aerosols and droplets that will cluster above you. And another thing that we like everyone to do, if it can be done, is to cohort the students. What do you mean by cohorting students is that if this small group of students have like a study group, or you're sitting together, whatever they do, they always do it together, so that in case anyone gets affected, it will stay within that small little group of students who have been cohorted. The other thing that we really like everybody else to do, and for you all to do also, is to the mask. Now, everybody has been using masks, and we are encouraging you all to still continue using the mask. Right now, we've been told that you can go out dining in Penang at least. I don't think everybody is going to do that just yet, but let us get back to mask first. So mask, as you can see, can be either cloth or they can be the medical mask. But whatever it is, please wear it properly. If you are going to wear a mask, it has to cover your nose, it has to cover your mouth, and it has to be tight on top, at the top of your nose, so that it pinches your nose and there is very well covered. At the moment, what we are recommending is that people double mask. So you can wear 2 masks, and what we encourage is that if you wear 2 masks, one should be cloth and one should be a medical mask. We do not encourage 2 medical masks, 2 cloth masks. So wear a medical mask has an inner layer and a cloth mask has an outer layer. The inner layer medical mask is disposable and you have to dispose of it properly. And the cloth mask, of course, can be washed and reused again. So if you're in school, what would be very good is if you could label your mask when you're in school, because children, they do take out their mask. They may take it out for whatever the reasons, to drink, to eat, and so forth. And the last thing we want is the mask to get mixed up. So please write your name on it, label your mask. And always clean hands before and after masking and dispose of the mask properly, especially the medical masks that need to be disposed. Please do not throw it everywhere and indiscriminately. And also you have to note that some people really cannot wear a mask. There are some people who have got bronchial asthma, who've got breathing problems. So there's no way that they can put a tight mask around their nose and mouth, and it'll be very suffocating for them. So some people cannot wear masks, but what we encourage is, if you cannot, at least wear a mask which is a bit loose. It'll give you some degree of protection. So this is a little bit about the, there are so much of posters and things about masking, all the do's, all the don'ts, how to put on a mask. So you really need to follow all this. And please note, N95 is the mask that medical personnel use for medical purposes. So please do not use that mask. We do not encourage people to use that mask because that is required by the doctors and the nurses in the hospital. Always adjust the mask to make sure that there's no gaps on the side. It covers your mouth, your nose, and the chin. And as far as possible, please don't keep touching your mask, because the mask outside is protecting you. And all the aerosols, everything will fall onto your mask. So it's considered as unclean. We try not to touch it. So before you remove the mask, you also need to clean your hands. And when you take it out, pull it away from your face. Okay? And then you store it if you are going to eat, and then you use it again. So these are some things about the mask. Another thing you always have to practice is please keep your hands clean. Keeping your hands clean is something that must be internalized, and it must come so naturally to you. And when you come home from outside, when you start something new, when you go to the toilet, when you come out from the toilet, when you are good, before you start eating, after you eating. So we encourage people to wash hands. And when you wash your hands, you have to do it properly. You have to wash it for at least 20 seconds. There are some times when you cannot really have soap and water to wash. So in which case, you can use a hand sanitizer. But even if you use a hand sanitizer, you have to make sure that it covers your palms and both sides of your hands very well. And that alcohol-based hand sanitizer must contain at least 60% of alcohol. And always avoid touching your nose, your eyes, your mouth. And if you're in school, we encourage that the teachers have routines that, encourage them to have frequent hand washing. So always learn good practices. Now, this practices is going to carry you whether you're in school, whether you're outside, wherever you are. And the most important one is cough etiquette. Anytime you feel like coughing, please do not cover your hands with your mouth and cough into your hands. Either you use a tissue or use your elbow and sneeze into the crook of your arm, because your hands are the ones that is going to touch everywhere, and this elbow is not going to touch anywhere else. So we want people not to cough into the open, not to cough into your hands, but to either use a tissue, and if you use a tissue, to dispose of it properly. And after you cough, in case you cough into your hands, please always wash your hands with soap and water, again for 20 seconds. There are other things that you need to follow, cleaning, disinfecting, and all the other things that need to make sure that your environment is safe and clean. If you're in a school, what we like is the ventilation to be very good, and to make sure that you maintain a healthy environment. First things though, if you're sick, please stay at home. In school, open windows where possible. And when there are students and there are a lot of people, the more you stay outside, it is still better because there is open air, there is ventilation, and there is no chance for the aerosols and the droplets to linger in the environment that you are. Because you know that the main mode of spread of COVID-19 is by droplets and by aerosols. So every time you cough, you sneeze, you talk, you are actually giving out droplets and you're giving out aerosols. And for the teachers, you try to allow your ventilation system to, to set it such that it allows as much outdoor air as it is safely possible to come in. In this weather, we understand that air conditioning is sometimes very essential, but try to allow for air to come in. Exhaust fans are very useful. So if you can put in exhaust fans, they should be especially be put into the restrooms and the kitchen because you want, otherwise the hot air will always be stagnant inside. There's another thing called the Hepa filters, which is the high efficiency particulate air filters. These are very important and it's very good to get rid of those little particulate matters. And this is especially good in the nurses' school. And remember that school bus that you were coming into school? Those school bus windows should be open. So again, even if you have minor symptoms, please do not go to school. And what we like is to keep children in pods. That means, little groups that they always move around within that group. So we keep it closed and keep it like a bubble. Now, although COVID-19 in children, so it is true that fewer children have been infected with COVID-19 as compared to adults, but please remember that children can be affected, children can get sick, and children can spread the COVID-19 to others. When we first started our lockdown in March 18, 2020, schools were closed. Everyone stayed at home. The only ones who actually went out were the adults, and they went to get only essential goods, groceries. So children had never had the opportunity to be exposed. So we were very comfortable with knowledge that children would always be safe. It is only when they started going to school that we realized that they started getting affected with cases. Children started being affected. So they are also susceptible to COVID-19. It's just that throughout, we've been very protective of our children and we have kept them safe. The other thing that we always talk about is about COVID vaccines for children. Is it safe? Right now, the adults are getting vaccinated, and I think up to today, at least about 28% of the whole population have been vaccinated, which is very good because with vaccination, we get protection. We hope that builds herd immunity, and we hope to keep the others who may not get vaccination safe. Studies have shown that COVID-19 vaccines are safe and effective. But like adults, children may have some effects after the COVID-19 vaccines, and the side effects may affect their ability to do daily activities. But whatever is said and done, they should go away in a few days. This is the findings from studies and from people who have been vaccinated in countries that have started vaccinating their children. So what are the possible side effects? It is just like the adult vaccines. For children, I'm talking about. On the arm, if where you get the shot, there may be pain, redness, swelling. Throughout the rest of the body, you may have tiredness, headache, muscle pains, chills, fever. And in case children do start getting these vaccines, they can always ask for a pain reliever, which is non-aspirin. But it's not recommended to give pain relievers before the vaccine if you want to prevent side effects. But this is where the problem comes in. This has been reported, cases of myocarditis and pericarditis, which is inflammation of the heart and the heart muscle. And some cases, they have been reported in adolescents and young adults. And usually it is after the second dose of the mRNA COVID-19 vaccines. But these reports are very rare. So the known and benefits of COVID-19 vaccine outweighs the known and potential risk, including the possible risk of myocarditis and pericarditis. But whatever said and done, Malaysia is withholding the giving of vaccines to children just yet. Then, what is Malaysia's priority? They have put the vaccination on hold, even though they started registering children less than 18 years old. But the idea was that when they start registering the children, the people who are going to get it, or the children who were going to get these vaccinations first, were those with underlying health conditions. And especially those with underlying health conditions who were planning to go back to school. And they were also going to hold on that healthy adolescents who had low risk to get it later. But who are the healthy adolescents? The adolescents are those who are aged between about 13 to 19. But since those 18 and above are already getting their vaccines, so this would refer to those aged between about 13 till 18. So, like I mentioned, other countries have given a lot of doses of vaccines to adolescents and millions of doses. And they did find that there is a low risk with Pfizer vaccines. But in Malaysia, we're still playing it safe and just holding on for a moment. But just to give you a little bit of data, which I could find, as of June 29th, 2021, there have been 116,378 children confirmed to be COVID-19 positive. So out of these, 37,025 are aged between 13 to 17. So these are the adolescents. So although children accounted for 15% of all the cases, they tended to be asymptomatic or they have milder symptoms. So it appears that children are less likely to develop severe illness, unlike the adults. But it still means that they do get infected and they get the infection. So we have, our population is about 1 in 15,000 are those in the age of 12 to 17 age groups. And like I mentioned, there are rare side effects, but studies have shown it seems to affect male adolescents and young adults more than females and other age group for some reason. So in Malaysia, so far, up till today, as I am recording this, Pfizer is the only vaccine that has been approved by the National Pharmaceutical Regulatory Agency. And this is the agency that does the studies and makes sure that the vaccine is safe to be given. And so this agency has said that only Pfizer is approved and is for use on children aged 12 years and above. Nothing has been said about children less than 12 years. So is there a compelling need to vaccinate children? So you have to rest assured that the country will look at everything and put it all together before they see whether there's a need or not. They will look at the risk. How does the risk measure up, the risk of not getting the vaccine measure up with the side effects of the vaccine? So they'll also be watching the variants because there are also the this virus can mutate and form a more potent virus that can be transmissible more easily. So we'll be watching, and then we'll be looking at the data. So the country will be looking at the data, will be watching the variants, will be looking at the risk before they decide whether they need to vaccinate the children. Probably the day will come when this will come. We think it will come, but maybe just not yet. So what can you do now? You're all at home. Life doesn't stop there. You have to live. You have to continue. So what we tell all of you all to do is please continue being in touch with your friends. Don't lose your friendship. You can be social, you can be physically distanced, but we are not exactly socially distanced. We still have our friends. We are continuing to be in touch with them. You can be in touch with them through the phone. You can text and, excuse me, and you can still maintain your friendship. So please keep your friends, support each other throughout this whole period of time. But one thing is, there's a lot of information going around, and there's a lot of false information going around. So make sure whatever you do, whatever you hear, that the source of information is always true. Sometimes the false information comes so legitimate, so believable. You feel you're forced to believe it, but always go check and see whether it is true or not. Eat healthy, have a well-balanced meal. No matter what you do, you need to keep up a good immune system. You need to maintain your immunity. And the only way that you can do that is by eating healthy, having a well-balanced meal, and sleep enough. There really is nothing else much to do, so you might as well have your 8 hours of sleep if you can get it. And have a regular routine. When you have a regular routine, it makes life so much easier, and you feel so much better when you get up in the morning. There are other options that you can also do. So what you can do is to create, just spend time wisely, don't whine. The whole world is in this together. You can learn a new skill. You can start reading books. You can start knitting like the guy in the Olympics, the diver from Great Britain in the Olympics was knitting, and this has become a new trend. Or you can take part in virtual runs. I have put here some of the medals that I've done. This was my project for this year. I'm only competing among myself. I take part in virtual tours, virtual runs. So these are a very good outlet because you also get your exercise in the safety of your home. And with that, I also want to thank Penang Tech Dome because they are organizing a virtual walk, the first virtual Glo-Walk 2021. So this is from the 28th of August till the 16th of September. And it is a good place for you to start. You exercise, you can compile all the distances that you walk. And what motivates you is to get a medal at the end. So spend your time wisely and think of something creative to do. There's so much you can do, really. You can watch Netflix, but don't spend your whole time watching Netflix because it doesn't give you anything else at the end of it. It doesn't give you that sense of achievement. Nothing like reading a book, exercising, whether you knit, even if you go out and go into your garden and plant some vegetables. All this, you will see something that shows the efforts. So these are all good things. Or maybe you want to study and you can, this is the time you can quietly sit at home and study and make sure that you beat everybody else in school. So these are the things that you can do. And please just remember, it will all end. The whole world is in this together. We are all in this together. I am talking to you from my house when in another circumstance, I'll be standing in front of you. But I know this will all end and it cannot go on forever. It looks hard and if you think that we are all there for each other, that is something amazing, because the human nature is such that we take care of one another. So in summary, what we just need to know is that cases are still continuing. And the only good thing, or we are very happy about, is that in Malaysia, the vaccination rate is the highest around. So our adults are getting protected. But even though we are protected, the SOPs are still there. I am not ready to throw away my mask. I am not ready to go out dining just yet. There are still far too many cases out there. So I will still carry on with my double masking. I will still carry on with my social distancing. The hand washing is something that I've always done all my life, so I will still carry on. Vaccination for children will come, but it's just not yet. So until then, what we can all do is just stay home, stay safe, and we can do it. So with that, I would like to say thank you.
Thank you, Dr. Saraswathi Bina Rai, for the good sharing. Yes, the COVID-19 cases are still continuing out there, so do follow the SOPs and stay safe. I'll see you tomorrow for another interesting topic.